The role of V1 and other cortical areas in visual selection. Part 2. Salient but indistinguishable inputs activate early visual cortical areas, but not the parietal and frontal areas. Although experimental data support the idea that V1 is responsible for computing saliency to guide attention exogenously, it is known that salient visual inputs typically also activate other brain areas, such as lateral intraparietal area and the frontal eye field. However, since salient visual inputs are more likely recognized, they are also more likely to enter awareness. Then, are these activations caused by saliency or awareness? Meanwhile, we have seen that some inputs can be quite salient without evoking perceptual awareness that they are distinct from background items. So let's use this strategy to identify which brain areas are associated with pure saliency signals. So we can use visual inputs that are salient, but human observers cannot distinguish them from background items. And we can use functional magnetic resonance imaging and event-related EEG potentials during human visual behavior to see which brain areas are activated by such pure saliency signals. First, let's see such a salient but non-distinctive input. This is where human observers fixate their gaze. This is an array of bars. All have low luminance contrast. These 2x2 bars are oriented differently from the uniformly oriented bars in the background. Their location is hopefully salient by having an orientation contrast. In this case, this contrast is 90 degrees. However, this image is only shown for 50 milliseconds and is then replaced by this image with the same fixation cross, and these inputs have high contrast in order to make it difficult to see this location of orientation contrast. Now, to verify that the observers indeed could not see where this contrast location is, this is another possible input before the mask. The location with the orientation contrast is at lower right from the fixation cross, and each possible contrast location is 7.2 degrees in visual angle from the fixation cross. After the mask, the observers have to report, guess if necessary, which one of these two possible images was shown before the mask. They were completely at chance in guessing the right answer. This demonstrates that indeed this salient location does not enter awareness. Now next we just need to verify that this location with the orientation contrast is indeed salient. This can be done by measuring whether the location of the orientation contrast has a significant cueing effect in an attentional cueing task. Like this. One of these two possible input images appears for 50 milliseconds. The location of the odd bars is the cue location for attentional cueing. The mask follows immediately and is shown for 100 milliseconds, and then followed by 50 milliseconds of just the fixation cross. Then, randomly, one of these two possible types of probe images appear for just 50 milliseconds. In each of them, there are two dots. The center of gravity of these two dots is at one of the two possible cue locations. It is equally likely that these two dots are at the same or opposite lateral side as the preceding cue. After these two probe dots disappear, observers have to report whether the upper one of these two dots was to the left or right of the lower dot. This is a difficult task because observers do not know before the dots appear whether the probe dots will be to the lower left or lower right of the fixation cross. So if the cue is salient enough to guide attention, the task performance should be better in the validly cued trials in which the probe dots appeared at the same side as the preceding cue, in contrast to the invalidly cued trials. The probability that the observers gave the correct answer to the probe task was about 70% when they were invalidly cued. But this percentage of correct reports was about 80% when they were validly cued. And this performance difference is the attentional cueing effect by definition, demonstrating that the cues indeed had a saliency effect even though the observers were unaware of their locations. This amount of cueing effect was when the orientation contrast was large enough, such as in this case 90 degrees. This cueing effect, reflecting the saliency of the cue, is expected to be smaller when the orientation contrast is smaller, and this was indeed the case in this experiment. The cueing effect was still significant when the contrast was 15 degrees, increasing the probe task performance by about 5%. But there was no cueing effect when the contrast was only 7.5 degrees in orientation. Now let's look at which brain areas respond to this pure saliency signal, which can guide attention, but observers could not recognize its visual location. This is the fMRI response from brain voxels in V1 in response to the cue locations when the orientation contrast at this cue is 90 degrees. These signals are usually called bold signals. In red curve is the time course of the response starting from the cue onset during the trials when the cue is at that location. And in blue curve is the response during the trials when the cue is at the opposite lateral side of the visual field location. And let's take this difference as a measure of the V1 signal to the input saliency of this cue. So these are the V1 signals in response to the saliency signal for 3 different orientation contrasts at the cue. This signal is strongest when the orientation contrast is 90 degrees and weaker when it's 15 degrees and near 0 when it's 7.5 degrees. And these are the responses at other cortical brain areas. The signals in V2 are still strong, although weaker than the signals in V1. And these are the signals in V3, and signals in V4 are still significant. And this is especially for the higher orientation contrast, of course. But the signals in the parietal cortical regions are insignificant at any orientation contrast. This rise in responses in V1 with increasing saliency is also seen in V2, V3, and V4, but not in IPS, frontal eye field, and LGN. This is consistent with these 3 regions not playing a significant role in saliency. Meanwhile, it's unclear from these data whether V2, V3, and V4 merely inherit saliency signals from V1 or playing active roles in saliency in addition to V1. These are the event-related potentials from EEG electrodes to the back of the brain close to V1. The horizontal axis is time since the onset of the cue. Now let's first look at these thicker traces of response signals. They are for when the visual input bars are in the lower visual field, like this one. And the responses in these thinner traces are those when the input bars are in the upper visual field, like this one. And in this time window, the responses change sign from being positive to being negative, when the lower visual field becomes the upper visual field. And such a response during this time window is called the C1 component. And its polarity change with such a visual field change is consistent with the idea that these responses come from V1 neurons. And this polarity change is caused by a particular spatial folding of V1 cortical surface in the scalp. This shortness of the latencies of the responses, starting around 55 milliseconds from the visual input onset, is another suggestion that these are V1 signals. Note that as the orientation contrast increases from 0 to 90 degrees, the response amplitudes also increase, as they should if they represent saliency signals. These data suggest that if we do not contaminate saliency signals by perceptual awareness signals, then they activate just the early cortical visual areas, but not the parietal and frontal areas, which are normally associated with top-down attentional guidance.